GDP just by preventing the incidents and occupational diseases, which is not very difficult to do if we have real intention. And I think we take a cue before we end this discussion. With all the colleagues and experts and professionals here, I am sure we'll be having few points to work on for the next few months, and maybe meet in the next year, maybe on this day, maybe here or somewhere else. I think we have to achieve something, and I think we should identify those areas where perhaps everybody will try to cooperate, collaborate, and support. I think that is the basis of this workshop today, and we have started with a very good note from energy that there is a lot of things can be done, and I'm sure we can do that. Thank you very much. I know.
Thank you, Mr. Sen. From railway, I can say that though initially railway was more concerned about curative and preventive services, nowadays railway is also taking a lot of interest on occupational safety and health. We have with us Dr. Sandeep Mitra. He's professor Railway Staff College, Baroda, where throughout the year a lot of courses are going on. My question to Dr. Mitra, will you consider something that some courses of occupational safety and health can be organized at Railway Staff College, Baroda regularly, so that awareness amongst other departments, officers is propagated regarding occupational safety and health? Today, during inaugural session also, we have noticed that lot of officers are not having proper knowledge regarding occupational safety and health. So, do you have any future plan to involve occupational safety and health as a course in your calendar?
Thank you, Dr. Saha. Though you are an expert on this, and many people like Mr. Sen, Mr. Mukherjee, Mr. Basu, and obviously from the government side, Mr. Chatterjee, they are experts on this. One thing just an overview, I reached here late in the afternoon. I read through the net also, wherever there is a subject I go through. What I understand, it's a saddening that in our country, having 1.2 billion people, there is no value for human life. Even the literate people do not understand this. So there is lack of awareness is very much there. Now regarding railway side, I am a bit proud that we have a safety norm, but to not that extent, not which is encompassing covering the entire ambit of the departments. Even I can talk about our medical department, patient safety is concerned. Everybody became very much cautious when this AMRI incident happened here, and one mere accidental incident which thereafter happened in Bangalore also. So our top brass, even I held a conference of chief medical directors, a workshop there at Baroda. So there the main theme was that patient safety. So every CMD was asked to present a paper. But the thing is that awareness at the grassroots level, and as well as this awareness, that interest level at the top level has to be there. Mr. Sen was talking about integration of policy. It is so important here. Definitely we are not USA, definitely we are not like Japan. The concept of this total TQM, as you know, total quality management and quality, etc., came in 1980s, and it transpired throughout the world from Japan only. USA took hold of this later on. Similarly, in our country, BHEL, BHEL took this in late 80s or mid 80s. But what about other companies? What about Mr. Chatterjee was talking about is very much true. They are scared of because of lack of awareness. So definitely, I will be, feel proud to be here amongst you people. And what Dr. Saha told me it will not be possible this year obviously, because we frame a course in the late November and it becomes finalized by late October, get finalized by November for the next calendar year. So I may think of it and I will talk to my Director General also, that because he is also President of Delhi chapter of this forum. So to incorporate certain courses where at least middle level managers in our service, they can attend there, and I may have a good contact with these people, enlightened people sitting here. I may call them also at Baroda so that they can share their ideas, and at least our people can have some knowledge with it. Thank you so much.
Thank you for the Mr. In this regard, I also like to mention you that we have some occupational health specialist here also. Dr. B. Sengupta, he is also one of the occupational health specialists. He has recently completed his training at Japan. Dr. Samuntrai, he is very much interested about occupational psychiatry, and he is associated with us. So we have a good team. Dr. Sengupta, do you want to say something in this regard?
Actually, I have formulated thank you, Dr. Saha, for highlighting this very important issue to introduce a course on occupational health in Railway Staff College, Baroda. Actually, we have tried to formulate a 3-day course on occupational health. We have prepared the baseline CD, so it can be modified further by other occupational experts, and if DG, RHS and Professor Health Management, Railway Staff College, Baroda approve this thing, then we can introduce that course in Railway Staff College, Baroda. Thank you.
Often with small steps, we can do a big thing. As an example, I just want to show 3 pictures. Though usually in panel discussion, picture is no. Here we can see 2 persons. It is a very common scene just beside the railway track. All of you have seen sometimes or other that this person just check the rail line kilometer after kilometer with a tool in his bag, just hanging on his shoulder like this, and with a small hammer. Every time he is just bending and just hammering it. So I have shown this picture to our previous general manager and suggested that if he can be given a haversack and a pair of shoes with ergonomic tool, that means his handle of his hammer can be long enough so that he need not bend every time. And with the haversack, his one shoulder will not have musculoskeletal disorder, what Dr. Basurai highlighted. So immediately my GM has accepted that and ordered that. This is another picture where lady gangmen are working. It is very nice to see them, but certainly not in this manner. They are just wearing the chappal and saris, which is not at all ergonomically suitable for this job. Their uniform has also been advised for changing. This is the guard of a train. At the time of starting the train, he is just showing the flag in one hand, and in another hand, he is having a walkie-talkie. And if driver starts the train suddenly, there is every chance that he may fall. So I have suggested that one safety belt can be given so that as soon as he climbed the train, he just fit the safety belt with the two handles, and then he can do his job without any. So this is a very small step. Nothing much is required to implement that, but we have to open our eyes to see everything, and then only we will be able to do this. Another thing, in our earlier in the guard carriage, there was no toilet, etc. So especially for goods train, they are running kilometer after kilometer, but there was no toilet, so automatically they will not perform their job properly. So nowadays toilet has been provided in most of the trains. So these are the few steps I just wanted to show. Thank you. And yeah, you can suggest, because you are expert in this field, you can suggest more.
Mike.
Third one, okay.
Mike.
Yeah, first of all, I highly appreciate these observations. These are the observations that change is, positively in any organization. Small things, but when you change this, adds real value. Now, only I have a small suggestion here. I highly appreciate your idea about securing the gentleman from falling down. My suggestion is, if we now securing himself with the safety, this person with the safety harness. Generally, safety harness comes with a lanyard. That's a kind of a 1.5 meter rope. Now, if he anchors it somewhere here in this area, and the train starts running, and this person falls down, he'll be dragged along with the train for some time. I had a suggestion. You can check with your design, or you can give it a thought. If he has got a removable kind of a harness with two hooks.
Safety check can be provided as it is provided in the aircraft.
Not safe. Safety. The general requirement is around 90 pounds of lateral load. So it can be a sleeved metal chain which can be hooked on this side and this side when this job is done. Oh, that only. Okay. Oh, this is the one. Okay. Only with the safety belt I was little. I got it. Okay.
Sorry, the terminology is
Oh,
but
fine.
idea is
This is the best.
immediately that can be just locked there.
Right.
That was my idea.
Great. Nice, the clarification. Really, yes.
Thank you for clarifying my terminology was wrong.
Not was excellent.
Anyway, Mr. Basu, do you highlight something, either what you have already told in the morning, because there is some hurriness in the, you can explain more something?
Thank you everybody. I took a session on safety, hazards, cost of accident and risk management and hierarchy of control. Now, thing is that what we have observed that understanding in the top management, I feel it is common in government and other organizations as well. Understanding about safety and awareness about safety in top management is quite high. But when we go to the shop floor employees, that is a problem. But those shop floor employees are more exposed to the hazard. So the challenge is that how we mobilize the shop floor employees. Now, definitely safety culture will be enhanced if the shop floor employees are engaged or mobilized in safety. So few things I can suggest is definitely a walk around and kind of a VFL, which I was talking about. VFL is visual felt leadership. So anybody can do, though in our organization the top management and executives do that, but it can be done by anybody. It is basically interacting with the people and asking their concern and logging those good practices or hazards in the database, or it can be even given in a feedback manner also. And the one-to-one interaction, that also is good when you talk about shop floor mobilization. It's basically talking to the people, asking their concerns that really matters, or else definitely the near misses as is always a challenge for us will not get reported. So we need